And we're back. According to data from I should say New York City Department of Health and Mental Hygiene, this 2022 data, the Bronx, the highest number of fatal opioid overdoses in New York City. One of the neighborhoods most impacted by the crisis is Mott Haven, which is home to the Samaritan Daytop Village's Peer Alliance Recovery Center. Now, for over 60 years, Samaritan Daytop Village has been improving the quality of life for New Yorkers. And joining us now to talk a little bit more about this, we've got Samaritan Daytop Village's Parks Assistant Director, Annette Evans, and we also got peer recovery professional, Jesus Hernandez. And thank you for joining us and being here with us.
Thank you so much for having us.
Thank you for having us.
I'm glad to have you, but the conversation is a little intense, right? I mean, when we talk about what's going on here in our boroughs, we said the Bronx leads New York City when it comes to opioid overdoses. What are you seeing on your end?
So thank you again for having us. On our end, we see a huge amount of people on the streets consistently using, actively using, and in need of services and support. We see a lot of people who might need the support, have barriers in coming in to ask for it, or not know where to go to get the help they need.
Yeah. Jesus, on your end?
Well, we do a lot of what we call boots on the ground, and we go right into the heart of the neighborhood and really meet the participants where they're at. And we're there to try to assist them, and if they're resistant to coming in for the services, we try to make sure that they're able to use safely while they're out there.
Yeah. I mean, the idea is really to eliminate it, but also reduction at the same time, right? And so for yourself, boots on the ground, when you're having these conversations and you're trying to get people into the area of reduction, talk to me a little bit about how it works and what that looks like.
I think for me, just being a peer, it allows me to use my lived experience. So I'm not talking to them like read something out of a book. It's something that I lived in the streets of the Bronx. So when I'm coming to them, I understand the perils that they're facing in the street. I understand that the disease and what it does to them, and that feeling of hopelessness that they have. And that's why working for Samaritan Daytop Village, it gives me the ability to give back to the community, to bring these people in and to show them through my example that it is possible to recover.
And Annette, there's work being done, I mean, in the community, government, really to call attention to the opioid, my tongue is tied, opioid crisis, right? Mm-hmm. And at the same time, while we're talking about a call to action, share with us a little bit about where we are there.
So we're really in a good place there. We are utilizing every platform to address the opioid overdose epidemic, also to educate our community at every level. Government, courthouses, Department of Education, health and hospitals. We work in unification together with all human beings so that people can find out where they could get the assistance from, including but not limited to small clinics in our community. We provide opioid Narcan training, to anybody who is seeking to assist somebody in an overdose crisis. But what's more important is having the conversation openly. It's no secret, not in my backyard. That conversation is no longer available. If people want help, they need to know in every household how to get it.
There's such a stigma, though. I mean, if you're honest, right? There's such a stigma that's placed on people who deal with drugs and substance abuse. It's a hard hill to climb personally, and then it's a hard hill to really admit to people who really are out there, I need some help. But for you, you're the help, right? So why don't you share a little bit about the help that's available, services that you have, that people can be able to come and partake in?
So the help that we have available is from anywhere from returning back to school, health and healthy living, by providing health services. We have free medical services for people who may not have been connected to a doctor or healthcare. We have mental health services. We have substance use services. We help people get back to work, continue their education, increase the knowledge in the household. I mean, if we feel like if we impact one person in the household, we can change a household, we can change a community, and it can be embraced. The barriers, however, are that hard hill to climb. And if people don't know where to go, they most likely won't seek it.
Right. Jesus, for you, what was the turning point for yourself, and then also the turning point that I think that that you're seeing in others that really make this change? Because it's a hard hill to climb, as we said, but many are climbing it and many are overcoming. as you.
It really was a hard hill for me to climb. You know, when I came into Samaritan Daytop Village, I was dishonorably discharged from the Marine Corps, and I came in with a sense of low self-esteem and a lack of pride. And when I came into the Veterans Program at Samaritan Daytop Village, they regained my pride for having signed on the dotted line and trying to serve my country to the best of my ability. Unfortunately, the disease is what took me out of the military. Having that pride and giving me an opportunity to start my life over again was what changed my life. And I owe Samaritan Daytop Village my life. I would not be sitting here if it wasn't for that program. And so that's why I'm out there, like I say, boots on the ground as a Marine, because we go out there, we train people with the Narcan kits, and these Narcan kits help save lives. I can't be everywhere at all times, but the more people that we train, the more boots on the ground, the more ground we can cover.
Right. Talk to us about Narcan. For somebody who may not be so familiar with Narcan, how does it work? And I know because I have Narcan training, but I want you to tell the people how it works.
Yeah, so I guess, you know, the short version, it's called naloxone, but it's more formally known as Narcan on the streets. And it's basically, it's a nasal dispenser that we use. And the most important thing about it is the 3 Ps. So we peel the back, we place it into the nostril, and we push it. And then usually within the first dose, we'd like to see that they're gonna come back from the overdose. Unfortunately, with the amount of fentanyl and xylazine and other new drugs that are coming into the borough, it's taking upwards of 4 more doses of Narcan in order to bring people back. That's why we need the help.
So when we talk about what we see on the street right now, we know about crack, we know about marijuana. Can we give me some comparison? How bad are we seeing fentanyl, opioid overdose? I mean, you're shaking your head like, yeah.
So it's very heart-wrenching. Unfortunately, we're seeing large amounts of overdoses. I believe the statistics from 2022 is like 831 deaths, overdose deaths. That is not always captured. Unfortunately, we do get the statistics from the Department of Health and also from the coroner's office, you know, when there's an autopsy. All I can say is that we have to educate our community as to what they're using. We have in our facility at Peer Alliance Recovery Center in the Bronx, 510 Cortlandt Avenue, and in Queens, we have a harm reduction vending machine. We provide wound care kits to folks. We send them to places safely to use. At that location, which a lot of people are against with the stigma, is that we're promoting use. No, we know that people are going to continue to use. If we can reduce health problems such as hepatitis C, overdose deaths in the safe injection sites, people can actually meet with a nurse, meet with a peer, go into treatment, and it has been helpful to save and reduce the number of overdoses that we've seen.
Yeah.
Yeah, so it's really heart-wrenching.
For yourself, obviously, you know, seeing people, talk about that tug of war sometimes, because you know what it's like to say, I'm on this side, but you also know what it's like to say, I'm refusing treatment.
Yes, well, you know, in Samaritan Daytop Village, where they taught me how to become a recovery coach, we learned to overcome our biases. Like for me, I believe in complete abstinence. But I remember when I was out there and I was using, I didn't want to hear that at the time because I couldn't hear the message at the time. So meeting them where they're at and just letting them understand that if they continue on this path, it's basically it's like playing Russian roulette out there, because the next one could be the last one. And sometimes you have to get that real with them to let them know, because this is not a game. This is a life or death situation, and we're here to save lives.
Yeah. Hey, Susan, I gotta leave it there. Congratulations, and we celebrate you on your journey.
Thanks
so
very much.
Annette, thank you.
Thank you for having us.
Good to see you in person.
We're excited. Yes, yes.
All right, listen, now if you want more information, go ahead and visit the SamaritanVillage.org website. We encourage you, don't go anywhere. We got more open coming up right after this.